The chair lays out House Bill 4713. The chair recognizes Representative Plesa to explain the bill.
Thank you so much, Chairwoman, Vice Chair, and distinguished members of this committee. I am honored to lay out House Bill 4713 before you today. House Bill 4713 provides insurance coverage for coordinated specialty care, which is a term of clinical professionals who provide holistic mental health treatment and is considered the golden standard for treatment of first episode psychosis, or FEP. The goal of coordinated specialty care is to identify young people in the early stages of psychosis, minimize barriers to treatment, and facilitate successful engagement in treatment while facilitating resilience. CSCs have been shown to increase treatment retention, reduce symptoms, and decrease future psychiatric hospitalization. It is cost-effective, promotes patient choice, and improves the quality of life and mental health outcomes of individuals experiencing FEP. House Bill 4713 seeks to expand the capacity for FEP treatment. Currently, the state level capacity can only meet about 35% of individuals in need. Members, I know mental health is a priority not just for me, but for all of us this session. For every member of the House, the Senate, the Lieutenant Governor's Office, and the Governor's Office. During the interim, Governor Abbott, Lieutenant Governor Patrick, Speaker Phelan, Senator Huffman, and Chairman Bonin put close to $1 million in funding more coordinated specialty care teams. This session is the first time there has been a dedicated line item for coordinated specialty care in both HB1 and SB1, demonstrating both chambers' commitment to funding CSCs and our approval of this golden standard for treatment model. We have recognized the importance and effectiveness of the CSC treatment model, and now we're boosting our investment in coordinated specialty care. As we increase the number of teams and providers that become available, we have to make sure that patients seeking this service have the insurance that will cover this treatment. This is the purpose of the bill, to require coverage for CSC treatment. I believe this treatment is a worthy cause for coverage. This is going to help address the mental health crisis in our state and is something we've already identified as worthy of our investment. Members, right now, on average, 3,000 Texas children experience FEPs each year. A majority of those who seek care are uninsured and have their treatments covered by federal mental health block grants. Those patients who do have insurance often run into issues with their insurance coverage, and providers also express frustration with the current billing and coding situation, leaving many elements of CSCs uncovered. The current reimbursement methodology using multiple billing codes pays for each service individually under the existing fee schedule for an individual practitioner clinic model. The current reimbursement rates are set using office-based assumptions that all services are being provided face-to-face, which excludes essential elements of the CSC evidence-based model. As a result, the traditional fee schedule does not reimburse adequately for CSC model. This effectively undercompensates the model that provides the most efficient, most effective interventions for a condition that can be quite costly to treat. The Meadows Mental Health Policy Institute published a report on payment strategies for CSC care, and they believe that a single billing code will simplify the billing permit issuers and set a valuation of the model that encompasses all key elements of CSCs. House Bill 4713 allows TDI to establish a work group, which includes group health plan providers and provides a recommendation on coding solutions. Elected leaders on every level are pushing this issue. The big city mayors of Texas have published a letter calling for more coordinated specialty care access, and I would like to read you a short sentence from that letter that stuck out to me. We know firsthand how lack of access to services leaves our local police departments as the primary safety net mental health provider for too many Texans. People living with mental health conditions need access to mental health services, and our police need to be able to better focus on public safety. My mayor in Plano, Mayor Munns, signed on to that letter, as well as mayors from every region in our states, including Amarillo, Lubbock, Fort Worth, Sugar Land, and more. This is not just a big city issue. The city of Uvalde has also dropped the card in favor of this bill because for the most tragic reason, they know why coordinated specialty care is beneficial and why it should be covered under insurance plans. Members, I emphasize to you that this has been a collaborative effort from the governor's office, the lieutenant governor's office, the speaker's office, and both the House and Senate chambers. The work and investments that have gone into making coordinated specialty care available across our state has been no small feat. However, members, we can fund all the teams we need, but it won't matter if patients can't access care because of gaps in insurance coverage. This bill would make this care more accessible and affordable. House Bill 4713 is harmonious with the efforts of our state's leadership and will close the loopholes and gaps in coverage as it relates to coordinated specialty care. House Bill 4713 is the missing piece we need to adequately address our mental health crisis in Texas. Chairwoman, members, I have some witnesses here to testify, and with that, I reserve my right to close.
Thank you. Members, any questions? Okay, thank you so much. We'll reserve your right to close. The chair calls Julie Gergois. Good afternoon.
Good afternoon.
Julie Gergois. Gergis.
Yes.
With Integral Care, and you are
Correct.
for the bill, correct? Thank you. Sorry to mispronounce your name.
No, not at
So
all.
sorry.
Good afternoon. My name is Julie Gergis, and I am representing Integral Care, the local mental health authority in Travis County. We support adults and children living with mental illness, substance use disorder, and intellectual and developmental disabilities. I am testifying today on House Bill 4713 because we see it as a means to expand access to a valuable service for children who are experiencing a serious mental health condition. A condition without effective treatment can be detrimental, can have a detrimental impact to the trajectory of their lives. One of our specialized mental health teams at Integral Care serves youth ages 15 to 30 years of age who have experienced their first episode of psychosis in the last 2 years. The team serves these youth utilizing a coordinated specialty care team, a CSC. This team consists of medical providers such as psychiatrists, nurse practitioners, a primary clinician, a peer support specialist who has lived experience themselves, a supportive employment and education specialist, and a family partner who also has lived experience with having a family member with a mental illness. These youth have their whole lives ahead of them, and our teams support them to achieve their goals and to be a part of the communities that they live in. In the past few years, our team has supported and guided our youth through the completion of high school, college, trade school, including culinary school, obtaining jobs, obtaining promotions within their jobs, returning to medical school in some cases, and developing fulfilling relationships with their families. There is a strong need in this area, and many times our team carries an interest list of youth waiting for a spot to open up so that they could join the team. There's a definite need in our communities to provide more access to these programs. Research shows that reducing the duration of untreated psychosis results in better outcomes. According to the Meadows Mental Health Policy Institute, options for improving CSC access include expansion through general revenue, adding CSC as a Medicaid bundle with adoption of a procedure code, and requiring private insurance to provide coverage for CSC. All these options support improving access to such vital, life-changing services for our youth. I want to thank you for the opportunity to speak today and your continued investment in mental health services. Thank you.
Thank you so much. Members, any questions of this witness? Thank you so much for your
Thank you. I
testimony.
appreciate
Thank
it.
you. Chair calls Blake Hudson. Blake Hudson, Director of Public Affairs, Texas Association of Health Plans, and you are against the bill, correct?
That is correct, and I lost Jose, so.
Thank you.
So a couple things here. including in the testimony on the second pages, I included a report from a group in California. Actually, Representative Paul, you have been supportive of this concept, and that is having an independent review for benefit mandates. And California has one. It's an independent group that's done through the UC Berkeley, and they had the same mandate. And if you look at that report, on the left side, they sort of have an at a glance where they summarize what was about a 40-page report with another 30 pages of appendices. And they say that this mandate for the benefit of 5,000 people would cost $70 million. But they also, and this is more important, they say it does not appear to be more effective than outpatient treatment as usual for other outcomes. So the state has a robust mental health pay parity law, which includes outpatient services. So a person can get unlimited outpatient services, essentially, and that's how most people get care right now. The state also looked at this specific program as the agency brought a budget writer a couple sessions ago, and this for another $20 million to fund these programs. The state decided not to do that. Now, we would support the state making that investment, but what I want to tell you is that this care is provided essentially through the LMHAs around the state, and they are very maxed out on, and they do see patients that are uninsured, Medicaid, Medicare, and private insurance, and they can bill private insurance, but those services are maxed out, and I have some concerns about just where this provider is going to come from, in addition to what we learned from the California report that says that it's actually not clear that this specific model of care is better than the outpatient care people are getting right now. I would caution against mandating, again, a very specific type of care, a model of care in the legislation when there are others that are available. So a couple other quick things. So another issue that's really interesting on this is when I looked at coverage churn. So a patient with first episode psychosis will often lose their health coverage because they'll lose their job. And what the LMHAs are able to do is they continue that care regardless of where you get your coverage from. So I would encourage that the state really look more at providing some funding for LMHAs to further provide these services and build out providers to provide these services. But I do have concerns with the bill as filed and the ability to make it work and the costs associated with it, particularly given what other states are saying about outcomes. I'll stop there and take any questions.
Thank you. Members, any questions of Mr. Hudson? Thank you so much for your testimony. Chair calls Greg Hanch. How do you say your last name? Hanch. Greg Hanch, National Alliance on Mental Illness, NAMI, Texas. And you are for the bill, correct?
Correct.
Thank you so much.
Good afternoon. Thank you for the opportunity to testify. Greg Hanch, Executive Director of NAMI Texas, in support of the bill. Members, this is an opportunity to be on the cutting edge of community mental health care. It is no secret that there is a youth and young adult mental health crisis, and there are no easy fixes to that problem. However, early psychosis intervention is backed by decades of research and nearly 10 years of community-level implementation in Texas. Contrary to what the prior witness said, this care is substantially better than run-of-the-mill community-based outpatient mental health care, and the research proves that. The momentum behind this intervention is so significant that the highest levels of leadership in our state have moved decisively to expand access to it. We know through empirical research that CSC keeps young people experiencing psychosis in school and reduces unemployment. It improves interpersonal relationships, and it reduces the risk of violence. The rate of homicide for a person experiencing a first episode of psychosis is 15 times the annual rate after people are treated. The LMHAs in Texas have been an extraordinary partner in making this service available in many communities across the state. And if the LMHAs are, quote, maxed out, then why are they supporting this bill? Texas started with 2 CSC teams in 2015. Now we have 42 of them. We need 100 of them. That's the estimate. Unfortunately, the financing mechanisms make it difficult to sustain these programs. CSC is funded through a finite pool of federal resources and piecemeal billing for certain elements. Several of the elements of CSC are generally not billable in commercial insurance. These include family education and support, supported education and employment, and outreach. CSC is team-based care, and team-based billing makes sense for it. Team-based billing is what we do for intensive outpatient. It's what we do for collaborative care. It's what we do for cardiac and stroke rehab programs. I understand the concerns about mandates. I would make a few points in response to that. School safety is an emergency item in this legislative session. Point two, 3,000 people per year experiencing a first episode of psychosis, but that's ages 15 to 35. This bill only goes up to the age of 26. 42% of the people in CSC programs are uninsured. The bill wouldn't apply to them. So a huge portion of that 3,000 people experiencing a first episode of psychosis are uninsured, and the bill doesn't affect them. So we're talking about a relatively small group of people, and that small group of people is among the most vulnerable people we have in our society. These are young Texans who are experiencing profound distress, delusions, and hallucinations as a result of a mental health condition. These are the people who are ending up in our safety net programs. These are the people who are ending up in the hospital. And without access to CSC, the default treatment for this population often ends up being the hospital. We can do better than that. I would lastly make the point that a lot of the services within CSC are already being billed for. There are a few elements that are generally not billable. So the $70 million figure that was thrown out about the cost of this bill just does not pass muster in terms of what this bill would actually cost to the state. We have substantial federal funding that has brought 42 teams online, plus the commercial insurance billing for it, and now we need to close the gap by making this a team-based billable service in the state. Thank you for the opportunity to testify.
Of course, thank you. Members, any questions of this witness? Okay, thank you very much for your testimony. Good. Does anybody else wish to testify on, for, or against House Bill 4713? Hearing none, call back up Representative Plesa to close on her bill.
Thank you, Chairwoman, and members, for giving me the opportunity to lay out 4713 before you. I want to thank the witnesses for coming and testifying. I just want to provide some clarity. LMHAs, they're for this bill. They express support for this legislation. They believe that it will allow us to serve a larger population of people who need and cannot access the service. This is not a provider shortage. Our state has made a lot of investments in bringing these clinics to us. This is a coverage problem. This is the lack in coverage. So people can't afford to pay for these services, essentially. Also, the Berkeley study, I don't know what California is doing, but my bill does not have a fiscal note. So this has no cost to the state. So there's no fiscal note. The LMHAs want this bill. I'll answer any questions, and with that, close.
Thank you, members. Any questions of Representative Plesa? Thank you very much.
Thank you so much.
Hearing no objection, or if there is no objection, House Bill 4713 will be left pending. Hearing no objection, House Bill 4713 will be left pending. Thank you very much.